So anybody have an answer to this question? First of all, what are Americans more afraid of than aging or even death itself? And I always start off by saying research shows public speaking, that they're more afraid of public speaking than even death itself. And so I tell a quick little story before I get started. I started doing it in this format about 8 to 10 years ago. And the reasons for it I'm going to get back to in just a couple minutes. But the very first 6 months I ever did this, I had my office team cancel all the new patients every single week and reschedule them for the next week for 6 months straight because I was so afraid to be in front of people. And next thing you know, there was dozens and dozens and dozens of people. So I've kind of gotten over the public speaking thing, so I always say be kind as we get started. And I always tell patients, if you have any questions during this, as we're going over x-rays and the scans and the health scans that we already did on you all, go ahead and if you wait till the end, I'm probably going to cover any questions that you might in fact have. And if you do have questions, I can address those at the end. So why'd I commit myself to doing this each and every week for the past now 8 to 10 years? Again, as I mentioned, I'm going to cover that in a little bit more detail as we go on. When I could be home, what would I be doing right now? Probably eating dinner, probably going fishing at this time of the year. And so I'll kind of cover that in a little bit better detail. What we're going to cover tonight is we're going to go over the x-rays in really, really good detail. They mean a lot to us, and there's a lot of information that we can extrapolate from those x-rays. We're going to be going over those in very good detail, not just putting them up there and saying, okay, here's what you got and that's it, but rather very good detail, and that's one of the huge important things of this. We're also going to go over, by this time you've all had a health scan that we do at our office, which was designed at the space program NASA. We're going to explain that in a little bit more detail as well, so I can correlate that together with your x-rays and you'll really know what we're looking at. We're also going to go over, there's a huge difference between long-term and short-term chiropractic care. Patients come into our office, some have been adjusted before, some haven't. Some come in because they have health issues they want us to help them with. Some come in because they have back and neck pain. And there's a huge third category that comes into the office wanting to prevent, they don't have health issues, they don't have back and neck pain yet, but they want to prevent those. And I'll kind of cover a little bit of that in detail as well. And we're going to go over prevention of the decay and degeneration processes in the spinal column and the prevention of health and disease type issues as well. Chiropractic, we're going to be going over some of the latest research on chiropractic that is very unfamiliar to most people. Sometimes I've lectured to medical doctors and chiropractors, and a lot of the latest information that I go over hasn't hit the news networks and so on and so forth yet. So by the time you leave here tonight, you'll know more than 99% of medical doctors and other chiropractors about the benefits of chiropractic, because some of the research is just off the wire, so to say. We're going to go over the decay and degeneration process in the spine. If anybody's ever been into a nursing home before, they know that the typical person when you're 80 years old, you don't look like this and you don't bend real easily. Most people, unfortunately, look like this. It's completely preventable. We're going to cover some of that tonight as well. Some of the research. I do not go over chiropractic research tonight because a lot of people are more medically oriented than chiropractically oriented or wellness oriented. The research that I'm going to go over about chiropractic and the benefits of it comes straight from medical research. Places like Johns Hopkins University, which we've all heard of, Mayo Clinic, Boston University, UCLA, Berkeley. We're going to cover those in really good detail too, in fast format. And a lot of the research comes from a New York Times best-selling book you might have heard of. It came out not too long ago called 1 Minute Wellness. There's 110 contributing authors, of which are medical doctors, National Institute for Health researchers, chiropractors, and I'm one of the contributing authors in this book. And if anybody ever wants to borrow a copy, we have several hundred copies left here. So feel more than free, just let us know and we'll go ahead and get you a copy of that as well. So that's where some of this research is going to come from. So kind of getting into some of that research, most people don't know that there's a huge correlation between spinal issues and health issues. Some of the latest research that have come out, you might have seen our office and myself personally on TV6 News several times over the last several years. Research studies coming out, first of all, on blood pressure. The University of Chicago is a very well-known cardiology research institution, and they've come out with several studies that show that chiropractic is twice as beneficial for high blood pressure as is medications, and there's no side effects that come along with it. High blood pressure is, of course, an issue with most males and females as they get older. High blood pressure leads to what? Heart attack, stroke, kidney failure, arterial sclerosis, and these type of issues. So we'll cover things like that, research about chiropractic in kids with ear infections. Chiropractic greatly increases the immune system function, which we'll address on a little bit tonight. Research studies on how chiropractic helps with things like asthma, allergies, infertility, multiple sclerosis, Parkinson's disease actually as well, greatly increases athletic performance. And I always say this as kind of a joking manner, but it's been shown to help prevent the #1 cause of bankruptcy. Does anybody know what the #1 cause of bankruptcy would be? It's actually medical bills. In the United States, the #1 cause of bankruptcy is medical bills. So the healthier somebody is, the less surgeries, the less medications that they need. A research study came out from Medicare, which people have as insurance in the United States as their older years, and shown that people under regular chiropractic care have 69% less medical bills in the form of medications and surgeries and hospital admissions, again, if in fact they are under regular chiropractic care. So the whys of all this we're going to get into here in just a second. Usually I'll ask a question. Are Americans globally getting healthier or less healthy as a unit over time? And most people would usually respond less healthy. And it's absolutely true. The health of Americans are going very quickly, exponentially downhill. Whether we're talking about things like allergies, depression rates, but also the big ones, heart disease, which is one of the leading causes of death, and a huge one is cancer. Cancer rates, the World Health Organization has now stated, cancer rates are supposed to double by the year 2030. Not just for the elderly. Most people would think, well, yeah, we have the baby boomers getting older and older. Of course, cancer rates are going to increase, but it's not just the older population, it's with the young as well. We've probably all seen in the newspapers recently, and you go into gas stations historically over the last several years, they have the little coffee cans in the gas stations with these little guys with cancer. It's escalating exponentially every single year. It's supposed to double by the year 2030. So kind of going forward from there, what do you do to change your health, because nobody wants these things? And there's very simple, small, strategic changes that you can make to your own lifestyle to help prevent these things, because nobody wants to, in fact, have these. And the simple things are, you just have to make simple, small changes. So I always quote this guy, and we all know this is Albert Einstein. His quote reads, "It's always hard to convince others of a new idea or theory that goes against established and accepted ideas. Even if the old theory is wrong and a new theory is shown to provide a better alternative explanation, it's difficult to change people's minds." This has happened with established teachings of physics, philosophy, and even medicine itself. So what I'm going to do tonight is I'm going to go over some of the latest research on chiropractic via medicine about the importance of chiropractic. But the change can be very, very easily, and the formula is in fact very, very simple. Tonight we're going to go kind of through the meat and potatoes of what chiropractic is all about, and why some of these leading research institutions that are medically oriented have now come out with statements that chiropractic is an absolute necessity if you want to be healthy, not only now, but into your older years as well. We all know exercise is a necessity if you want to stay healthy long-term, eating well, and chiropractic is now in that category. And so we'll flash forward through a couple slides, and like I mentioned, hit the meat and potatoes of everything. From this point forward right now, I'm going to mimic many parts of a lecture done by a gentleman named Mark Victor Hansen. If anybody knows who he is, we've all heard of the Chicken Soup for the Soul books that have sold more books than any other book in human history. He gives many lectures around the globe to chiropractors, but also many to medical doctors as well. And he's organized a lecture in such a format to give to medical doctors, and I'm basically going to go through what he goes through with medical doctors. So from this point forward, I'm Mark Victor Hansen, and you're all medical doctors. The very first thing we'd start off with is you all have rubber bands on your water bottles, I trust. And if you could take that rubber band, Mark Victor Hansen would say, if you would please, medical doctors, take that rubber band and wrap it around your index finger about 3 times so it's snug but not too tight. And I actually wrap mine about 8 to 10 times so that we get the point in a couple minutes as we go through the points we're trying to make. So he'd start out by saying, who is this? And this gentleman actually is Thomas Edison. More inventions than any other person in history that I could research by Googling. He was once stated as saying that the doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. And that's exactly what we do at our office, by the way. As chiropractors, we deal intensely with care of the human frame, but we also dive into diet, nutrition, and some of the other, very few, by the way, simple things that a person has to do to get healthy and stay healthy. So we'll kind of get into everything right now. How the heck is a chiropractor adjusting somebody's spine going to help you get healthier? I'm going to answer those questions right now and what chiropractors really in fact do. To keep it as simple as we could possibly keep it, chiropractors remove nervous system interference between your very, very powerful brain and the rest of the body. So the next question would be, well, how powerful is your brain and what is its purpose? Before I dive into that any further, the brain has two separate, distinct entities as jobs. Number one is the brain produces actual electrical impulses in the form of electricity to power your immune system, your organs, your biochemistry. That's one job. The other job that the human brain has is it coordinates and controls over 20 trillion, with a T, 20 trillion bits of information each and every second with your body. To put that in perspective, the latest research would show that it would take a computer with the latest technologies, the size of the Empire State Building, to do each and every second everything that your brain does. Okay? Kind of self-evident truths, but not as much as most people might realize. So taking that into consideration, we go forward and say, okay, the nervous system, the brain, we look at what would happen to a person if their spinal cord was either cut slightly, severed, or even nicked. And what would happen is that person would in fact perish instantly, because now there's a complete disconnection between that very powerful brain and the rest of the body. So that being said, we're going to go into one of the worst case examples of nervous system interference, again trying to get across the point of the importance of the nervous system in an actual living person. And so most people realize that the guy on the screen is Christopher Reeves. That's kind of where we'll start this process. What happened with Christopher Reeves is he was in fact, and if anybody doesn't know who Christopher Reeves was, he played Superman in the late 1970s. He was an actor, and he became a quadriplegic. He was riding along on a horse, fell off the horse and hit the ground. The second he hit the ground, he slightly fractured the top bone in his neck, allowing it to move way out of alignment. When that happened, again, he didn't cut or nick his spinal cord because he would have perished instantly. What happened with him, again, using little tools up here, if this is his spinal cord, if you would, for just a minute, and this is the top bone that he fractured in his neck, here's the second bone in his neck. As he fractured that bone, his spinal cord did this. Now we have 20 trillion bits of information from that huge brain trying to get through that already small spinal cord, completely choked off. If water's trying to flow through here, it will only trickle through. We have 20 trillion bits of information and electrical impulses that can only trickle through at this point in time. So kind of getting some references to when bones move out of alignment, exactly what happens. So with Christopher Reeves, not only did he become a quadriplegic, losing all muscular functions for the rest of his life, but what else didn't work with Christopher Reeves? He had complete, in computer terms, systems failure to his body. His heart and his lungs needed machines to pump for the rest of his life. His digestive tract, his lymphatic system, his immune system, thought processes, blood pressure, everything quit functioning in his body for one reason and one reason alone. He had a bone out of alignment so far that it shut down his nervous system function down to about 5% of what it should be. So, kind of reiteration, what does the brain control? It controls everything in the body, every cell, every tissue, and every organ in that body. And that's why we as chiropractors is so intensely take consideration to exactly how that nervous system is functioning. And that NASA scan we're going to talk about in just a couple minutes, that's exactly what it's testing, is how much nerve interference that we have. So, as chiropractors, what do we call those bones that move out of their proper proximity? Those bones that move out of alignment? It's simply called a subluxation. It's simply a bone that moves out of alignment, putting pressure on those nerves. And some analogies, we already went over this. All the subluxation, no matter where it is, or in multiple areas of the spine, most patients we deal with, of course, do not have Christopher Reeve size subluxations. I oftentimes call them mini Christopher Reeve subluxations. Bones out of alignment, decreasing the potential of the function of that nerve, just not nearly to the same extent. What that would look like on a model with electrical impulses flowing through it is we have 24 bones in the spine. Whenever bones move out of their proper alignment, it's going to choke off that nervous system. The green light flashing quickly represents a nervous system that's functioning to its fullest potential. Whenever bones move out of their proper alignment, it creates that interference. And that's exactly what we deal with as chiropractors on a day in and day out basis. So moving forward, research. Usually about a third of the patients in the office are more analytically minded, so I do go over, as I mentioned earlier, a lot of medical research. The first one we're going to hit is from the University of Colorado. Their medical school subcategory, their neurology department, started doing research not long ago on these subluxations. And what they found is that within 60 minutes of a subluxation, up to 60% of the nerve carrying capacity can be lost. We have primary nerves that come out of the spine going to each and every organ, whether it be your heart, your lungs, your kidneys. So the University of Colorado then went on and they said, now we want to do some more research. We want to see how long after a subluxation occurs can we actually, with the microbiology department now, actually find changes underneath a microscope to the organs that those nerves go to. So what they did is they took a bunch of lab animals and they were testing the function of their liver. And so they took all of these lab animals and they wanted to make sure a couple things. First of all, the liver, the organ that they were testing, was in fact healthy, and they wanted to make sure that, of course, the nerve going to that organ was healthy. So they did their tests and they took all these lab animals that were in a healthy place at that point in time. They then artificially induced, with force, a subluxation to the bone that protects the nerve going to the liver. So they moved the bone out of alignment. And then what they did is the microbiology department, they made a small tissue sample. They took a small cut in the lab animals, very small tissue sample of only a couple cells of the liver, and looked underneath a microscope. What they found is that with every single lab animal, within 1 week's time, the very beginning pathology process begins. It's called cellular swelling. They could actually see with every lab animal changes with the liver within 1 week's time of that. Doesn't mean the liver shut down in 1 week. It simply means the process has begun. It happens for two reasons, by the way. Whenever a bone moves out of its proper alignment, it affects the nerve going to that organ, but that nerve going to that organ also affects the blood supply to that organ. So you get kind of a double whammy with the subluxation. You get a decrease in nerve supply and you have a decrease in blood supply. An example, I keep this plant here actually for a reason. All living tissue works exactly the same. If for a moment, if this could be a nerve heading down that animal that we just talked about, and let's say this leaf right here happens to be the liver, and this is the nerve going to the liver. Let's go back to the plant now for a second. If I keep pressure on this plant over periods of times, days, weeks, months maybe, what's going to happen to the leaf? Not just sometimes, but all the time. Right now I'm decreasing the electrolytes, the water supply through there, life force if you want to call it. That leaf's going to begin to wilt eventually. The exact same thing happens in lab animals. What they found is they can find changes within 1 week's time. Again, if we leave that interference there over weeks and years, we start having major issues, which we're going to go into the first case study. And the very first case study is there's been research done both chiropractically and medically since 1910 in the United States on exactly what we're going to go over. What they found is that a very, very large percentage of people that die of organ failure, whether it be heart failure, liver failure, kidney failure, on their autopsies after that person has died, they found huge percentages of those people on autopsy with major subluxation and damage to the nerves going to whatever organ failed. The percentage is actually 96 to 100% of people that die of organ failure. They find exactly what I'm about to show you on autopsy. Okay? So if you can see from back there, this is the spine, the bones in the spine that we'll be looking at on the x-rays in just a little bit. These are all the nerves going out to the different organs right here. If you can see this nerve right here, it's large, it's healthy. This nerve right here, it's large, healthy. You can see right here, this nerve is, you can take it off a little bit if it's causing some pain there. This, this nerve right here, you can see it's withered up, shriveled up, kind of decayed and degenerated. That's exactly what they find. The reason of that is that bone is rotated out of alignment, choking that nerve off. Remember we just went over a couple minutes ago, within every single lab animal, within 1 week's time, they can find changes to that end organ. If we leave that though over long periods of time, we can start having major changes like this. This was an actual male patient, a 55-year-old male patient who died of kidney failure. Okay, little history behind this guy. He felt completely healthy up until 1 month before he died. And number two, he didn't have any back and neck pain to speak of. And the point of that is you don't have to have back and neck pain to actually have nerves so damaged that organs begin to shut down. So that's a fallacy a lot of people think as well. If I have nerve interference, it's going to cause pain. Only 10% of the nervous system actually transmits pain. 90% of the nervous system's job is to control the other 20 trillion bits of information each and every second. 55-year-old male patient, 1 month before he died, he started feeling kind of queasy. He went into his medical doctor. His medical doctor did extensive blood studies, finding everything pointing to the fact that his kidneys were shutting down. They then went in to look at his kidneys, and they found they were very withered up, shriveled up, decayed, and degenerated. Think of a healthy organ looking a lot like a grape, as the analogy goes, and an unhealthy organ looking a lot like a raisin, real shriveled up and degenerated. That's exactly what they found. They scheduled him to do a kidney implant, but before they were able to do the kidney implant, the patient died. And this is exactly what they found on the autopsy, and that's exactly what they find in 96 to 100% of people that die of organ failure. Again, whether heart failure, liver failure, kidney failure, lung failure, whatever that might be. And hopefully at this point in time, you're starting to kind of grasp the reason that I kind of sit down and go over this in good detail with each and every single patient that comes into the office, is because a subluxation in the spine can lead to major catastrophic health issues as well. And so putting this aside here for a minute, we'll kind of jet forward, and case study done. So what causes all these subluxations? Why is the average person that's 80 years old look like this, right? There's three major causes of bones that move out of alignment. Three causes: trauma, stress, and toxins. And we're going to hit just a couple minutes on each one of those, actually a couple seconds. What do I mean by trauma? You don't have to get hit by a train to move bones out of alignment. Simple day-to-day activities like lifting, turning, twisting, pushing, pulling are more than enough to move bones out of alignment. Harvard Medical School, now we're going to get into more research in depth. Harvard Medical School has now researched the fact and found that the very first subluxation happens during the birth process itself. How? Whether C-section or natural birth, here's what the birth process looks like. The obstetrician, the midwife, right, will take the baby's neck and pull with somewhere between 30 and 60 pounds of pressure in this direction first, right, pulling up, and then laterally bend the head and twist back this way, trying to pull the shoulders out. Keeping in mind, all these bones aren't even all bones yet. A lot of it's cartilaginous material, cartilage, and so the very first subluxation can happen during the birth process, and in fact does in most cases, Harvard Medical School states. So our very first subluxation happens there, whether C-section or natural birth. And again, just to put it in perspective again, if I did have a baby right here, and I was going to hand this baby to somebody, how would I do it? You'd be holding onto the baby, very gently holding the neck, because we all know the neck is a very delicate area, and you'd very carefully, and they'd grab the neck, and because, why? It's a very delicate area, you don't want to hurt the baby. The birth process is where the first subluxation typically happens. From there, and here's more of the Harvard Medical School. Harvard Medical School, and this is quotes, states that research indicates the major cause of subluxation, the first cause is childbirth, stressing the need for correction from birth so that irreversible subluxation degeneration changes do not occur. Basically, a lot of big words for decay and degeneration and nervous system interference. Harvard Medical School has also stated that subluxation can cause three major issues. We've already covered the first one. They've stated abnormal function of the organs, of the immune system, these type of issues. The next one is abnormal behavior. There's billions of biochemical processes that happen in your body each and every second. If your brain isn't properly coordinating the biochemistry of your body, a lot of the brain controls the biochemistry of the body, a lot of that biochemistry goes through your bloodstream, through your blood-brain barrier, and affects your brain. It can cause abnormal behavioral patterns. Look at depression rates nowadays in the United States. And they've gone as far as to state that it can cause, in fact, early death. And here's one really simple way, other than what we mentioned here, a really simple way to understand that. They did a research study at Boston University and Harvard Medical School coming up with the exact same results. What they found on babies that died of sudden infant death syndrome, most people know that you put a baby to bed at night and the baby passes away and nobody really knows why. What they found is that over 87% of babies that die of sudden infant death syndrome have major damage to the upper cervical neck, most likely from the birth process in and of itself, meaning a subluxation so far out of alignment, it chokes off the spinal cord right up here where the brainstem is, shutting the respiratory centers down in their sleep. That's exactly why on a day-to-day basis, as you're in here being worked on, you'll see a lot of kids that are little babies that apparently look very, very healthy, but we'll be in here working on them. We want to keep them healthy and prevent health issues into the future. So Harvard Medical School, abnormal function, abnormal behavior, and early death. That's Dr. Abraham Taubin, if anybody wants to Google it online. Flashing forward. Now, what else causes subluxations? We're still kind of in the trauma component of things. The average baby falls how many times by the time they're 5 years old? If anybody's a mom in here, 5,000 times by the time you're 5 years old, a typical baby will fall. And so imagine I picked up the spine off the floor right now, and this is a baby walking along, and I dropped the spine onto the floor. That's what it would look like, you know, that average baby. Pretty soon we're holding on to here as a baby. We make a couple steps as we get gutsier, you fall over. 5,000 times by the time you're 5 years old. Again, creating the scenario of why we have so many issues with nervous system interference and decay and degeneration later on in life. So moving from trauma. Second component of subluxation is stress. How the heck would stress cause a subluxation? We have hundreds of muscular attachments up and down the spinal column. What happens to your muscles when you get stressed, by the way? They get tight, right? Those hundreds of muscular attachments up and down the spinal column, as those muscles are tight, are pulling on those spinal bones 24 hours a day, 7 days a week, as long as that stress is there. And again, are Americans stressed nowadays? Obviously, yes. And by stress, I mean work stress, school stress, relationship stress, mental type stress. Research studies have now shown that driving in and of itself is 1,000 times more stressful than our bodies can adapt to. Meaning, I'm in a car doing 60 miles an hour in this big 1,000-pound chunk of metal. Here's another car 3 feet away doing 60, that's 120 miles an hour. A fight or flight stress response goes off subconsciously in your body every time that happens, releasing stress hormones, causing the muscles to get tight, pulling the bones out of alignment, and so on and so forth. So stress. The last one is toxins. What do I mean by toxins? Anything you know is bad for you. Caffeine, nicotine, alcohol, pesticides in the foods. Our medications, do most of them have side effects? Well, yes, absolutely all of them have side effects. The reason for that is the toxins that are inherently in the medications. Is there a purpose for medications? Well, we all know there is. But they have side effects from the bad stuff they have to put into the medications, which can, again, cause subluxations. How? We take in caffeine, alcohol, pesticides in the foods, pollution in the air. All of these go through our bloodstream. When we have toxins in our bloodstream, eventually they're accumulated into the muscles. When they are, the muscles get tight, just like when you're stressed, and the same thing unfolds. The muscles are tight, pulls on the bones. Like orthodontics in reverse. Orthodontics put forces, positive forces in the teeth, crooked bones to move them back into alignment. This is exactly the opposite scenario unfolding. So, moving on from stress, trauma, and toxins, the three causes of subluxations. So, we're born to function at 100%. How many people at 80 years old are very healthy anymore? The average person that's 80 years old in the United States is on 6 to 7 different medications just to keep them alive, and their posture doesn't look so good. It does not have to be that way at all. Percent nerve system function. We're born to function at 100% and stay that way through most of our lifetime. What happens though is we go through first the birth process and we're less than 100%. We fall 5,000 times by the time we're 5 years old. All the lifting, turning, twisting, pushing, pulling. Then you add stress and the toxins of today's lifestyle. Unfortunately, The typical person, by the time they're 40 to 80 years old, are in this general ballpark right into here. Christopher Reeves, by the way, only had 5% brain body function right here, and we know, and we already talked about what his organ function was in fact like. Moving on, the immune system is a very, very important function in your overall health, most people know, right? New York University, their medical research institution, has found that chiropractic over the long term will increase a person's immune system between 200 and 400%, which we're going to get more into. We work with the Cancer Treatment Centers of America, and we deal with a lot of cancer patients, and cancer has everything to do with the immune system, which we're going to get back to. But talking about that for just a second, New York University, what they're saying here is that the nervous system controls virtually every aspect and every organ of the immune system, and it's very important that that nervous system is running to its fullest potential to make sure that that immune system is functioning to its fullest potential. Two ways we check for subluxations. Number one is the Nassau scan, which we're going to cover, and number two is x-rays. And so first covering the Nassau scan. So I imagine that each and every person here has had the Nassau scan done by this point in time. This is where I kind of go over two case studies. We go over a lot of case studies at our office. We go over two case studies, and we're going to go over those right now. So this is a 21-year-old female patient, by the way, and the longer the lines are, if they're ever colorful, by the way, it's major nerve interference. Green is the least amount of nerve interference, but green is enough nerve interference that it's causing issues with the organs underneath the surface, like as we mentioned before. So green is bad, blue is worse, red is severely choked off. The reason that this was created was to find out what the health of, in fact, the people that the space program, NASA, the astronauts, and so on and so forth. This is a Nassau study of a patient, again, 21-year-old female patient. She was referred into our office not with back and neck pain, but she was referred specifically into our office because she had infertility issues. She had never had a cycle her whole entire life. Okay? So what else did she have? She had major headaches that affected all aspects of her life from the time that she was born. She had major neck pain, allergies, and again, never had a normal cycle. This is the first Nassau scan that we did on her. We started a system of chiropractic care, and several months later we did the next Nassau scan. We go from here, and her next Nassau scan is in fact right there. It's way less global colors. What is that showing us? It's showing us the bones are in better alignment, and just like taking the pressure off that hose we mentioned a couple minutes ago, the nerves are functioning way better. So this is, in her case, I believe it was 4 months later, exactly 4 months later. Where's her life at this point in time? Headaches are basically gone that have plagued her for darn close to 21 years of her entire life. Allergies, much better. By the way, allergies have a lot to do with the immune system. Neck pain, way better. Concentration and focus, way better. Her biochemistry is coming around in her body. Energy levels increased. Overall mood's way better. And she had her first cycle 1 month after starting care. Okay? So her whole life has changed. The reason she came in here is because she wanted to have children someday. Tons of research studies on infertility issues and chiropractic as well. There's our first study. The second study, if any of you are from the local area, you might know this little guy named Chase. His last name is Waters. So Chase was referred in here. This is his first nerve scan. The reason he was referred in here is from the time that he was born up until the time he came into the office, he had asthma so bad that it was a life-threatening issue. Their parents had to rush him to the hospital at 80 miles an hour, not knowing if he was going to be breathing by the time they got there, to be on respiratory machines for the next several days in the hospital. He was on tons of different medications from the time that he was born until the time he started in our office. At either 3.5 to 4 years old, I believe he started in our office. Not healthy. The 24-hour flu would last a week with him. Constant colds, constant ear infections, an immune system that's completely and utterly shot. What this is showing us is nerve interference patterns all the way through almost every aspect of his spinal column. So he was referred into our office, right? We did the nerve scan. We started immediately, more aggressive than we would a typical person. We saw him more often. His next nerve scan, again, look at the global features of the nerve scan here versus about 3 to 4 months later. This is only has 3 problematic areas in his spinal column. So how did his life change? He started care in our office about 2 weeks before Halloween of that year. They noticed a little bit of changes, but the first major change they've noticed was 2 weeks after he started care. They were out trick-or-treating that night, and the friends that they were out trick-or-treating with said to the parents, "Is Chase running around?" Because before he couldn't run from about here to that fish tank over about 10, 12 yards without dropping onto the ground. The asthma would flare up to the point where the lungs would go into reaction and he'd start projectile vomiting at times, mucus, right? He noticed 2 weeks later he was able to start running around. From that point forward, he's not having to been shipped into the hospital at 80 miles an hour. He's off every bit of his medications at this point in time. By the way, what I didn't mention was he had to be taken down to the University of Michigan on several occasions because it was so bad. Medical prognosis, we don't know. We have to keep him on medications, and it's not good. He wasn't able to play. Imagine now how this would have affected his self-esteem growing up, how his immune system not functioning well might have led to other major catastrophic issues. So that's Chase. Those are the two case studies I go through and kind of explain the Nassau scans so you know what we're looking at when I correlate the Nassau scans together with the x-rays. The next thing we're going to hit is the x-rays. So within days of a subluxation, permanent decay and degeneration begins to build up in the person's spinal column. Going to the dental analogy, within 24 hours of not brushing your teeth, you're going to have, albeit very small amounts, but permanent decay and degeneration building up in your teeth. The exact same thing happens to the spinal column itself. If you never ever brush your teeth, the average dentist will tell you that by the time you're 22 years old, you'll have lost your last tooth. Right? We all know now, inherently, it's just part of our culture. If you don't brush your teeth, you're going to lose them. We have way too much processed foods and these things now not to have that happen. We know if you take care of your teeth, even at 80 years old, you can have a great set of teeth if you do two things. Brush 2 to 3 times a day and floss once a day. It's just common sense. Most people don't know it's the exact same thing with the spine. We can completely stop the decay process if you're young enough so that the decay and degeneration do not continue to get worse over time. Let me put a little preface into that. If somebody gets hit by that train, it creates some more issues in there. What I'm talking about is a normal human being going through normal day-to-day activities. We can completely stop that decay process if done properly. Again, the same thing with the spine. Within days of a subluxation, we have changes begin. What we're going to be looking at on those x-rays. This is a person's x-ray from here to here. Okay? Some of the most important things that we're going to look at on those x-rays, we don't want to see it look like this underneath the surface. We want to see it 100% completely straight. Whenever bones move out of their proper alignment, if this could represent a spinal column for a minute, whenever bones move out of their proper alignment, it causes nerve interference. Some people begin to shift like this, which causes extensively more nerve interference to whatever organs those nerves are coming off to in these angles right here. We mentioned a research study earlier from 1910 to present day. Several things have been found. 96 to 100% of people that died of organ failure on their autopsy showed major subluxation damage, and the nerves, we just covered what they look like. One other thing was shown on that as they laid the people down. They found major lateral curvature. Say this nerve is coming out going to the kidneys. They found lateral curvature like this in that area. So that's another thing that we're looking at on those x-rays, which kind of brings me back to a place where I usually take a quick breather before we finish up. Why do I do this week after week? Again, when I could be home fishing or doing whatever else I might be doing. It's actually a reason that precipitated me to do this because I hated public speaking in the very beginning. And again, when I get done seeing patients all day long and I'm here working hours and hours and hours, so from 6 to 7 at night, I'm doing this once a week. Why do I do it? This is the precipitating factor. When I first started my practice, I thought, you know what, I went through well over $100,000 in school loans. I went through 4 years of pre-med, 4 years of chiropractic university. How am I going to define if my life is a success? And I thought, you know what, if I can, so back and neck pain, it's great to help people with back and neck pain. But if I can help change one person's health, that'd be awesome. 1 month into care, I had a, like I mentioned earlier, actually, infertility case come into my office. And she and her husband had spent between their money and insurance money over $300,000 trying to get pregnant and nothing would work and they were giving up on. Within 1 month of care, a lot like the patient we just mentioned, a different person, she had her first cycle. Within several months later, they conceived and carried full term. And I thought, well, cool, my life is a success. My practice got very busy very quickly at that point in time, and I couldn't sit down with each and every patient that came into the office as a new patient and explain this in this much detail, because at some point I have to actually work on the spines themselves. And so several months later, I started getting busier and busier. A patient came in, a male patient, and he came in for back and neck pain. His back and neck pain cleared up very quickly. Within a couple weeks, it cleared up, and he dismissed himself from care. A couple months later, I was looking at the obituary columns at my parents' house, having a cup of coffee, a toxin actually, but having a cup of coffee, and I think it was a Sunday morning, and I saw his name in the paper. And I thought several things. Number one, first thing I'm going to do is get to the office. I'm going to look at what his scans of the nervous system show me, and I'm going to find out what he died of, and I'm going to take a look at those x-rays as well. Got to the office, found out, first of all, that he died of, as the bold says, kidney failure. Looked at his nerve scans. His nerve scans showed huge amounts of nerve interference in various parts of the spine, including right where the nerves went out going to the kidneys. His x-rays in that area that goes to the kidneys, if this is the nerve that goes to the kidneys, showed this. And I thought, I did a much better job going over this information than a typical person would, but could I have done more? And at that point in time, I made a commitment to myself and every other patient or potential patient that would come into our office that at the very least, you'll have a loaded gun of information so you can make an educated decision. You know, once we look at your x-rays, I'm done with my job. If you want to start care, great. If you don't, at least I know that you know the ramifications of the studies that we do. And so that's exactly why I do this on a week in and week out basis. So going further, one of the most important x-rays we're going to look at is the neck curve actually. Some other things we're going to look at though is decay and degeneration. Everybody here has probably heard of degenerative disc disease. You don't catch it, okay? Bones, when they're out of alignment, this is normal, this is worse, and as we go down the line, it gets worse. Whenever bones move out of alignment, the discs will begin to degenerate over time. You see the discs get smaller and smaller and smaller. The reason we don't want that is because as these discs get smaller, the bones collapse upon each other, and where the nerves come out, the nerves progressively are destroyed. And we start having a scenario like we talked about here. We'll look at disc degeneration on your x-rays as well, and we're also going to look at what's called bone spur formation. Whenever bones are out of their proper alignment, the ligaments get pulled irregularly. When those ligaments get pulled, the body starts laying down calcium deposits. Eventually, those calcium deposits will infiltrate into where that nerve comes out, and once again, progressively destroying that nerve. Some of the other things we're going to look at on the x-rays, other than your lateral curvature this way, is disc degeneration and bone spur formation. So most people will ask, well, can chiropractic care stop this process? As long as we catch it early enough, absolutely we can stop the bone spurs from getting worse, and we can stop the disc degeneration from getting worse, okay? If a person's young enough, we can actually reverse to some extent the bone spur and the disc degeneration. That's kind of an extra bonus, but we're not going to take it from here to here, but we can actually see it go from here to here. And with patients, oftentimes I'll go over case studies of patients that said, yeah, let's share my case, and I'll actually sit down and show you areas where, see that bone spur here, see this bone spur here, X amount of time later, it's gotten smaller, and we go over issues like that. So, what those look like, by the way, the bones should all be virtually square, kind of like building blocks as a child. This is a person's neck looking in this direction, okay? The bone should be pretty much square. See how this jets down here? This is all a bone spur right there. A bone spur that's way bigger right here. In this area, the bone spur is so big it's completely fused together. Just kind of give you an idea of what we'll be looking at. Right up into here, this is a disc from here to here. See how small that disc is back here? There's a lot of disc degeneration to that area there. Not as much here, but still some disc degeneration. As we come down into here, there's hardly any disc and no disc left at all. So those are the things that we'll be looking at on those x-rays. The most important x-ray we look at by far, more than anything else, is the neck x-ray and the curvature of the neck x-ray. What we want to see on the neck x-ray, this is a person's jaw. you're looking in this direction right here. We want to see a curve that looks like a banana. Now this is where some of that major research is going to come into play. Research from Johns Hopkins, from Mayo Clinic, Journal of Geriatrics, which is a medical journal, what they've now stated. Let me take a step backwards actually. We want to have a banana curve in the neck. And this is a kind of an old banana, and I apologize for that. Whenever bones move out of alignment, the neck will begin to straighten and then begin to come forward. Again, the typical 80-year-old looks like this. As the bones are out of alignment, the neck will begin to straighten. And the same thing happens to the spinal cord that will happen to the fruit on the inside of this banana as I begin to straighten this banana. As I straighten this banana, the fruit on the inside, we all know, is going to get squished. The exact same thing happens to a spinal cord. And that's where anything from Nobel Prize winning research from neurosurgeons, one specifically is Dr. Brieg, which we'll go over in a second, to the Journal of Geriatrics, has stated that if your bones are out of alignment and that neck straightens out, it equals a decrease in lifespan and increase in mortality rates. It's very, very important. Why? Because that spinal cord's getting squished. We went over the Christopher Reeves analogy. So as I straighten this banana, as we can see in the back, it's starting to get squished right here. The exact same thing happens with the spinal cord. We'll be going over more research with that with you as we look at those x-rays. Dr. Brieg, B-R-E-I-G, by the way, medical doctor and neurosurgeon, Journal of Geriatrics, right here. Again, decrease in lifespan. So remember the rubber band? I saw several of you started turning forms of purple, and probably they're off by now. So I'm back to Mark Victor Hansen. This is all the information he would have went over with medical doctors, trying to get them to understand chiropractic, trying to get medical doctors to understand health outside of, let's just give you drugs or do surgery, or what other weapons do they have to deal with. So Mark Victor Hansen would say, okay, medical doctors, let's look at that rubber band again. Remember we went over, the University of Colorado found that within 1 week, we can see changes on a microscope in the microbiology department of an organ. Imagine that this is a nerve going to, say, your liver or your kidneys, and we have nerve interference there. Okay? What's this rubber band doing to the end of my finger? If I leave that rubber band on my finger, what's going to happen to my end of the finger? Not sometimes, every single time. If I leave this rubber band here for a couple more days, the cells of my finger will be gone to the point where the end of my finger is gone. It's going to have to be, well, amputated. Thank God the nervous system doesn't happen that quickly, but the same type of long-term ramifications can occur. So what should I do? Again, obviously you want to take the interference off. Rebuilding a person's spine over time looks a lot like this. We gently make adjustments in the spinal column, less nerve interference, less nerve interference. By the way, why is the end of my finger going to die? 2 reasons. Number 1, nerve interference. Number 2, decreased blood supply. The same 2 things that happen when there's interference to a nerve going to any primary organ. So over time, I get rid of that nerve interference and I increase the blood supply. The body is an awesome, I call it, self-healing, self-regulating, vitalistic entity. Your brain has so much unlimited potential. As long as we can catch that nerve interference before it's too late, that body's going to begin to heal again, and we covered some of that. And oh, by the way, if you have rubber bands on your finger, definitely take them off. And that way you don't leave with them on. Okay, so this is kind of where Mark Victor Hansen would kind of end with the medical doctors. I'm going to go into a little bit more detail right now as far as what chiropractic care looks like. If a person wants us to stop the decay process completely in their spine, so we don't end up like this, and they want us to fully wake up that nervous system, what does that look like? If a person's here for just back and neck pain, I might adjust a person for a week, for a month, 5 or 6 adjustments, and their pain might start to change. By no means does that mean we have the spine back into alignment to the point where we've stopped the decay process and woke up that nervous system. That's why we take x-rays and we do the Nassau scan. So what does it look like if a person wants us to stop that decay process and wake up that nervous system? How long does it take to rebuild the spine? And I always use the orthodontic analogy because it's absolutely perfect and people understand it. We're taking crooked bones of the spine just like orthodontists are taking crooked bones of the teeth. Over time, we put forces into the spine to systematically bring those bones back into alignment. You cannot take crooked teeth and move them back into alignment overnight. You just can't do it with the spine either. There's no way that can happen. How long does it take to rebuild teeth? Anywhere from 6 months to 5 years typically. Why does it take so long? There's ligaments, there's tendons we're dealing with. In the spine, there's muscles. in the spine. We're continually resubluxating our spine, which all takes time. How long does it take to rebuild a typical adult spine who's never had major chiropractic care in the past? A typical person between 18 months and 2 years to rebuild a typical adult spine. For the same reason it takes time with braces. A typical adult patient, what would their recommendations look like if they told me, Doc Guy, rebuild my spine? Stop that decay process, wake up that nervous system. A typical adult might look like this. About 3 times a week for about 10 weeks, about twice a week for about 10 weeks, and then once a week thereafter for the remainder of that first year. Why? It looks like this to rebuild it. We have bones that are out of alignment. We make an adjustment. We don't go like this. We make an adjustment like this. Immediately before you're even off the table, the muscles want to pull it right back to where it was. Before it does, we get in here a couple days later, make another adjustment. It's kind of 1 step forward, or I'm sorry, 2 steps forward, 1 step back over that period of time. The most important thing towards rebuilding a spine by far is to stay on a proper schedule. Kind of like the most important x-ray we look at is the banana curve in that neck. The most important thing is to stay on a proper schedule. Without it, we lose ground. It would be like going to the orthodontist and you continually take your braces off. We're not going to make that kind of forward progress. This is my favorite part of every single week right here. Why long-term chiropractic care? Well, we fix the problem. We stop the decay and degeneration process dead in its tracks. If a person comes in that's 96 years old, which is my oldest chiropractic patient I've ever seen, which was my great-grandmother, by the way, yes, it's going to take a long time and it might never get completely stopped with the decay process, but we can still wake up those nerves very significantly. We've had very good changes with health with people even in their mid-90s. Little side note, the oldest patient I've ever had that had been under regular chiropractic care over her whole lifetime was 93 years old, and it was at Chiropractic University. She'd been adjusted on a regular basis from the time she was born until she was 93. Her x-rays looked better than most people's x-rays that I take at 19 to 20 years old, by the way. Absolutely amazing. So it's stopping the decay process, increasing the unlimited amounts of potentiality in the brain to the rest of the body, the whole nervous system thing. Why am I this type of chiropractor? I deal with patients with back and neck pain, but most of the patients that we see are here to get healthier. I was diagnosed with a life-threatening condition called Crohn's disease. If nobody knows what that is, it's an ulcerative disorder of the intestinal tract. What happens, medically speaking, nobody knows exactly what causes it, but your intestines begin to shred. You begin to have a ton of diarrhea and a ton of bleeding, and people with Crohn's disease have a shortened lifespan, and it cycles downward. You get a little break in things usually, but then it'll cycle further downward. My case, I first diagnosed with it, and in my late teenage to early 20 years, I was diagnosed as Crohn's disease, right? Medically, I was on Azicol. I was on prednisone, which is a heavy-duty steroid. My case was so bad, I actually had to give myself a medicated enema every morning and every night. Nothing was helping, as with a lot of Crohn's patients that we see, and I'm spiraling downward. Somebody said, go to the chiropractor, and I said, what in the heck would that have to do with Crohn's disease, and you're crazy? Well, finally, things got worse and worse, and I said, what do I have to lose at this point in time? My Crohn's disease was so bad at one point in time that my medical doctor said I was 4 days away from being dead. I turned completely gray, about the color of your sweatshirt, by the way, and I was 4 days away from being dead, and I was down. I had lost about 50 pounds in weight, okay? Started chiropractic care. Within a 6-month period, I was off all of my medications from the time in my early 20s till the time that I was 36 years old. When I was 36 years old, I had another flare-up. What caused the subluxation? Stress, trauma, toxins. At that point in time, I had just bought this building. I was helping with research, not only with the National Institute for Health, but we were putting together the book. We had 4 doctors working here. I wasn't systematized. I wasn't sleeping. I was working nonstop. My chiropractors were still working on me, but I was causing subluxations more than I was able to get them back into alignment. I did have a flare-up. Is there a place for medicine? I went on prednisone for 1 month. Kind of got me back on track a little bit, and for the most part, I'm medication-free for that whole time. That's my story. Cancer. Why are we so passionate about cancer? Well, first of all, it's supposed to double by the year 2030, says the World Health Organization. We see a lot of cancer patients in our office, and we work as an aftercare center with the Cancer Treatment Centers of America, which most people know and have heard of on TV. I'm going to go over just one cancer patient tonight, and I want to show you the potential of a person's body to recuperate from cancer when they're not supposed to live. If anybody here works at the hospital, this is actual PET scans of a cancer patient. She's right around 32 years old when she was first diagnosed with cancer. Just so you can see, the areas of black, for the most part, are all cancer. Not here, this is her brain. Not here, this is a shield over her thyroid, okay? All of this is cancer here. All of this is cancer around her intestinal tract. 32-year-old female patient works for Marquette General Healthcare Systems, diagnosed with cancer. Marquette General said, we don't know if you're going to live. We want to send you to the University of Michigan's oncology department to see what they're going to do for you. She got to University of Michigan. University of Michigan told her, same thing as Marquette General. We don't know. We want to do, because it's so severe, we want to do experimental radiation therapy on you to the point where you can't be around your 2-year-old at the time, your 4-year-old, or your husband for right around a 2-week period for several yards away from them because there's so much radiation emitting out of her. That's how bad the cancer was. Do symptoms tell you if you're healthy? A side note, she had no idea cancer was proliferating throughout her body until she quit having bowel movements. Cancer was so wrapped around her intestinal tract that she couldn't, in fact, have a bowel movement. 32 years old, came back home. Her best friend referred her to our office. Her and her family were patients here and said, go see what they can do for you. She came into the office. We did all of our nerve scans. We did the x-rays. We got started immediately. Not 3 days a week. We got started 5 days a week with one primary purpose. I want to make this very, very clear. I'm not saying that chiropractic cures cancer. What I'm saying is chiropractic gets your immune system functioning to the fullest potential. 32-year-old female patient, we get started with care. We don't see her 3 times a week, we see her 5 times every single week. Again, I want to make it very clear, as I was just mentioning, our purpose isn't to cure cancer, that's not what we do. Our purpose is to get your immune system running to its fullest potential. Your immune system has one huge primary purpose, that's to find cancer cells, track cancer cells first of all, kill cancer cells, and get them the heck out of your body. So we start seeing her on a very regular basis. Within 3 months, from February till May, that's where the second PET scan was taken. The secondary PET scan shows cancer at that point in time is about 40% out of her body. The next PET scan here, February 11th of a year after this one, she was diagnosed 95% cancer free. 0 medications, 0 chemo, 0 radiation. The only medical intervention that she had was the diagnostic testing. And by the way, cancer had gone systemic and it was actually shown in her bone material as well. That's how bad it was. One of the most severe cases of cancer that you can imagine. At this point in time, 1 year after the final x-ray, PET scan, 2 years after she was initially diagnosed with cancer, she was diagnosed completely 100% cancer free. Okay? Again, what did we do? Research of chiropractic shows that in a typical human being, not diagnosed with cancer, New York University has found that cancer rates the immune system will increase in 200% function over a several-year period of rebuilding the spine. In cancer patients whose immune systems are way low, they find that the typical person with cancer, your immune system under chiropractic care will increase up to 400% stronger. Again, the immune system's already weakened. So from there, from cancer, kind of the whys of what we do. On a typical time when I give a lecture like this, right, we're going to go over the x-rays in just a couple minutes. At this point forward, historically over the last 10 years, about 70% of people here, them and their families, will get under what I call hardcore rebuilding. About 20% will kind of not really hardcore, but it's really good for your spine still. And there's that 10% that'll kind of do a short term and a kind of a once in a while chiropractic. Where we go from here is always in your ballpark. We're going to go over these x-rays in just a couple minutes. But before we do that, I'm going to go ahead and pass you a lot of changes going on in the healthcare systems. I always pass these out on each and every week. And we just kind of go through these. On the front, you'll see a declaration from the state of Michigan talking about the importance of chiropractic care. If I can go ahead and have you read down to the second paragraph where it says, whereas. This is talking about chiropractic and the importance of the nervous system. What it says is the proper function of the nervous system and correct alignment of the spine are paramount to the body's ability to grow and develop appropriately and to work effectively and efficiently. And just kind of, you can take these with you for sure. If you can scan to the next one, that's where we have our mission statement that I wrote about 8 years ago for Family Wellness Chiropractic. What it says is that we at Family Wellness Chiropractic are committed to serving the true healthcare needs of as many people as possible within our reach. We acknowledge the devastating effects of vertebral subluxation on human health and therefore go to extraordinary measures in educating our communities about the benefits of chiropractic for the restoration of health. Our mission is to serve as many people as possible. Our mission is to serve as many people as possible with the highest quality care so that these masses may realize their full human potential. We encourage our patients to help us by participating in this most important and noble mission. And right here is where I go, where would that cancer patient be if she hadn't been referred in here? We see most of the patients, new patients in our office, most of them are from referrals from other people that actually take the time to explain these things. Chase was the exact same way. Every patient actually I went over tonight was referred in here by other people. On that token, there's just some other stuff here. There's the Chase thing right here, the case study to take with you, and you can read over it later if you want. What this is a golden invitation. We give all the new patients that come into the office. Every single new patient that comes in this format, this is for a loved one, a family member. By this time you understand, man, chiropractic, I had no idea. Some of the stuff we went over tonight, I'm sure at this point in time. This is for an absolutely free, where we go over, we do a Nassau scan, we take x-rays, we'll go over this information with them in good detail, and just like with you, at that point, we're done with our job. We'll go over it, we'll give them the recommendations if in fact they are a chiropractic patient, and we go from there. So, in closing, why long-term chiropractic care? There's 3 leading causes of death in the United States. Most people know cancer is one of them. Most people know heart disease is one of them. We've addressed cancer tonight. We've addressed high blood pressure studies and heart issues. One of the other 3 leading causes of death, most people have no idea, depending on which study that you might look at, is in fact medicine in and of itself. Now, thank God there's medicine, because it saved my life on several different occasions, but you want to be on as few medications as humanly possible. And here's one example for you. Most people would say, if I was to ask you, what's one of the safest medications that there is other than the placebo? Most people would say aspirin. And I'd say, okay, great. If you don't know these things about aspirin, which your medical doctor most likely doesn't tell you because they're so busy seeing sick people, it's hard for them to keep up on this research. Aspirin kills more people every year in the United States than AIDS because it causes ulcerative bleeding, number 1. Number 2, a lot of people are still unfortunately taking an aspirin a day to keep the heart attack away. For years, research thought that taking an aspirin a day to keep the heart attack away would decrease your risk of a heart attack by 37%. Research came out 4 months ago and said that's absolutely not the case, and if anybody you know is still taking an aspirin a day, tell them not to, because aspirin increases your risk of a hemorrhagic stroke, where you lose half of your body function, by 87%. This is one of the safest medications that there is. What else did aspirin find? Harvard Medical School 3 months ago found that taking an aspirin or 2 a day to keep the heart attack away increases your risk of cancer by upwards of 80%, which is higher from the studies that I've seen than smoking. Just thoughts. Again, there's a place for medicine, but to watch yourself with that. Vioxx, for instance, remember Vioxx? Vioxx came out as a huge painkiller. Vioxx, in and of that one drug over a 5 to a 10-year period, killed more people, over 50,000 people, more people than were killed in some of the wars that we fought, right? 50,000 people in a short amount of time. So again, the purpose of all that, you want to be on as few medications and take as well care as you can of yourself. By keeping your spine in great alignment, by eating some pretty good foods and exercising once in a while, there's absolutely no reason that at 40, 50, 60, 70, and 80, you continue to get healthier and healthier and healthier as time goes on, and not be on 6 to 7 different medications by the time that you're 80 years old. 3 reasons most people don't start long-term chiropractic care. What are they? Finances, so there's 2, and time. Time frames. Yes, we enjoy when a person comes into the office, lay down in the massage chairs that help relax the muscles, ligaments, and tendons, help break up the scar tissue of the spinal column, you know. But if you're under time frame issues, we can get you in and out pretty quickly if you need to. We enjoy to sit, relax, and do those type of things, but we can get you in and out fairly quickly if you need be. Most people do relax, so we can put you ahead of those other people. Finances and finances, and this is one huge point I want to make. The last reason we ever want anybody leaving the office is because of financial issues. We've designed our office in such a way that if you ever have financial issues, talk to myself for sure. We'll sit down and we deal with people with financial issues all the time. That's the last reason we ever want anybody to leave our office. So make sure you plug that one into your brain and you always remember that. Because tonight, what I'm going to do is I'm going to go over the most important x-ray with you tonight. I'm going to go over your banana curve in your neck. As early as you can tomorrow, come back in here. We'll give you your first adjustment tomorrow, and I want to sit down with you personally and take a lot more time and go into a lot more finite detail on your x-rays, bone spur formations, disc degeneration, other abnormal curvature patterns, and correlate that together with, in fact, your Nassau scan as well. So let Beth know. What we'll do is I'll move into a room, take whoever needs to get out of here the quickest, go over your x-rays tonight, and then tomorrow we'll go into the rest of that information. Any questions that you have tonight, write them down. Please bring them with you tomorrow. I will give you tomorrow, if you are in fact a chiropractic case, I will give you recommendations to rebuild your spine completely. What you do with those, I'm done with my job then. You let me know if you want us to do anything and to what extent you want us to do anything. We also tomorrow will go over what it would look like financially to rebuild the spine. I'll give you those numbers, and then from there, again, you're the boss. It's 100% in your ballpark at that point in time.